Hello everyone and welcome to today's International Nursing Webinar Series. My name is Jerome Barbate and I'll be your host and moderator. I'm originally based in the Philippines, but in the last 5 years in Sydney, Australia. And I'm excited to be hosting this session today. I'm pleased to introduce today's speaker or presenter, Dr. Suryanto. Dr. Suryanto is a lecturer, researcher, and clinical supervisor at the School of Nursing Faculty of Medicine, Universitas Brawijaya in Malang, Indonesia. Malang is in Eastern Java, all right? He received his master's and PhD degrees at the famous Monash University, Australia. He has presented in national, international fora over the years. I first met Dr. Suryanto in 2011 during an international conference in Cebu City. And since then, I have maintained connection with the gentleman from Indonesia. Today, we'll talk about pre-hospital care in Indonesia, preparation of the nursing workforce to deliver an ambulance service. Before I hand over to Dr. Suryanto, I have a few housekeeping items to cover about this presentation and the webinar platform. First, today's webinar will be available after the live session and is accessible to YouTube. Next, we'd like to hear from you during today's presentation. Our colleagues from various countries, in particular Indonesia, Thailand, will be joining us as panel reactors. I'd like to introduce them very shortly. Lauren Joxin is a lecturer from STIKES, TMS Bingkolo in Sumatra, and Dr. Sanglar Pulnok, assistant professor of the School of Nursing, Nariswan University. And last, we'd like to encourage you today to share today's webinar with your social networks, particularly Facebook, Instagram. I don't have an Instagram.
Oh, you should.
other platforms. So without any further ado, I'd like to kick things off by welcoming our Dr. Suryanto. Over to you. Thank you very much. Dr. Suryanto.
Yep. Thank you very much, Professor Barbate, for the opportunity for me so that I can share one of my research in here. So welcome as well, Dr. Sanglar Pulnok from the Thailand, as well as Mr. Lauren Joxin from Bengkulu. So today I'm going to share about the research of my PhD research, my doctoral research, titled Prehospital Care in Indonesia, Preparation of the Nursing Workforce to Deliver an Ambulance Service. So this is the content that I would like to share. So start with background and then move to the aim. And then I will discuss about the study 1, 2, and 3. In here, we can see that there are 3 studies focusing on this topic. And then lastly, I will discuss about what's next we should do based on these 3 studies. So start with the background. So Mr. Lauren probably already understand that pre-hospital care in Indonesia remains underdeveloped. So in the case of emergency, for example, like any car accident, for example, or any fire, for example, in Australia, like Professor Barbate can dial 000 for emergency care services. So within minutes, the ambulance services, the firefighters, as well as the ambulance, the police officer will come to the scene. In America, for example, they have 911. I'm not sure about the Thailand, but in Indonesia, in here still question mark. So is there any emergency call or emergency service in Indonesia? Yes, we had. And it was called the 118 Emergency Ambulance Services. It was established around 2000 and kissed due to the financial issue. So at that time, for emergency cases, mainly for the medical cases, not for firefighter or criminal emergency, for example, only for emergency, health emergency related cases. So the community can call 118, and then it will be connected to the nearest hospital. But due to financial issue, it was changed, and every single places, it can be established around like 4 or 5 years maximum. And start from July 2016, Indonesia established the 119 emergency medical services. The establishment of the 119 emergency medical services, there are 2 major developments, which is the establishment of the National Command Center, or NCC, in Jakarta, and as well as the establishment of Public Safety Center, or PSC, Initially, during the launching in 27 location, which is the 27 location established at the 14 of out of 34 provinces, which is quite small number. But now it's now has been developed in many cities, but less than 200 cities out of 515 cities in Indonesia. So in general, we have 34 provinces in Indonesia, and there are 514 cities in Indonesia. Actually, based on that regulation, started on July 2016, actually every single city and regency in Indonesia should have the PSC of Public Safety Center. But the development of the establishment of the PSC, it's vary place by place, and still most of the ambulance services are hospital based instead of the system create a good system for pre-hospital care. So the implementation of the system, the 119, is not well organized, and the implementation is varied from place to place. So, for example, in Jakarta, the most organized, the most developed of the system for emergency cases, medical emergency cases, the whole community, the people, the person can call 119 and will go directly to the provincial public safety center. But the other city, they don't have it. In Malang, for example, we have it, just launched about like less than 1 year, or maybe 1 year plus, not about like 1.5 years. But it's not really well organized like in Jakarta. We have call center, but the call center do not really connect it with Jakarta itself. That's why the Malang have their own call center number, which is mobile phone, not something which is sometimes it's not easy to remember instead of 119, but the mobile phone number consists of 9 or 12 digits, which is hard for people to remember. So it's very varied, the implementation of the system for Indonesia. So some of the cities also implemented the mobile system, the application. So it's really varied. Then the result is most of ambulance services still are hospital-based. So these ambulances are staffed by a driver and nurses who achieve no formal training in pre-hospital care. So most patients are transported to the hospital using public transport or private car without sufficient care during transportation. So that's become the main problem of Indonesia related to pre-hospital care emergency cases. Because why people using public transport instead of ambulance? Because like I mentioned before, that the ambulance sometimes it's hard to call them. So it's easy to go to the hospital by public transport or by their own car instead of calling the ambulance. In big city like Jakarta, it's easier to get the ambulance. But Indonesia, very large population, and then the facilities, the ambulance services is not as easy in Jakarta. So most of the people using public transport instead of ambulance. If the people calling the ambulance, yes, ambulance can come to them, but sometimes the ambulance is not really good quality. So still provided by the hospital or puskesmas, community health center, because in Indonesia there are two major health facilities, hospital and puskesmas, which is community health center. And the ambulance still staffed by driver and ambulance nurses. And for a good hospital, high quality ambulance can be available. But in the puskesmas, because still, not every single puskesmas has a good ambulance. So some of the ambulance within the puskesmas only have like oxygen only and the stretcher, that's it. So there is no other equipment inside of it. So it becomes an obstacle to implement the emergency medical system in Indonesia. And what about the human resources? There is no paramedic or EMT profession in Indonesia. In Australia, for example, they have like a specific human pre-hospital care human resources called paramedic. In America, for example, they have EMT, the emergency medical technician. In Singapore, they have EMT, emergency medical technician as well. But in Indonesia, we don't have it yet. So currently, emergency nurses are responsible for providing the majority of pre-hospital care in Indonesia. Most of them are emergency department nurses, so ED nurses. It really depends on the hospital. Some of the hospital have like a specific human resources, like specific nurses working only in on ambulance. But like in smaller hospital in puskesmas, so there is no specific nurses working on ambulance. So they are working in shift. So for example, they will work on ambulance, for example, like once in a week, for example, or maybe 2 days in a week, for example. So it really depends on the hospital. However, there is no formal education of or course for those emergency nurses staff the ambulance. Some of the hospital have like a specific requirement, like for example, the ambulance nurses should have like a basic life support training, for example, or ATLS, blah blah blah, for the higher hospital, for example. But for like a low level hospital, there is no regulation. So it can be like a fresh graduate because there is no more people fresh graduate working on ambulance. Sadly, unfortunately, that during the formal education of nurses in Indonesia, whether diploma in nursing or maybe bachelor in nursing, most of the students were taught mostly on in-hospital emergency care, not in pre-hospital emergency care. So it become like, questionable whether they are good enough working on ambulance or they are ready enough to work in ambulance if they're not really well prepared during their nursing education. So the aim of the research. This research aims to identify the current status of pre-hospital care in Indonesia, its policy, operational, and workforce challenges, and the barriers to its development, and make recommendations for improvement. Three objectives with three spirit studies were designed, which is to identify whether nursing graduates are work ready to be ambulance nurses. Like I said before, that based on the national curriculum of nursing education in Indonesia, focusing in hospital, not pre-hospital. And the second one is to describe the perceived competency level of ambulance nurses in the pre-hospital setting. In here, I want to know, are they good enough for nurses who already work at ambulance? Are they good enough to provide the care in pre-hospital care? And then the third one is the outline the decision makers' perspective or the barriers and solution associated with implementing in an EMS system in Indonesia. Meaning that I was asking what is actually the problem of the implementation of EMS system in Indonesia, and what are their suggestions to improve the system. And then let's move to the study one. The study one titled "The Work Readiness to be an Ambulance Nurse Among Nursing Graduates in Indonesia." It was a quantitative study using questionnaire, which was adapted from previous study by O'Brien, Moore, Hartley, and Dawson, 2013. A pilot study was involved 12 nurse graduates in Indonesia, and the Kromba alpha was 0.9, which is good. And the main study involved 94 participants from mostly coming from Malang area. So I invited the nursing graduates, fresh graduate from Malang area and surrounding to participate in the study. And what are the results? So the participant score in the ethic and legal responsibility domain was the highest, and the practical skills domain was the lowest scores. So in brief, that in questionnaire there are 8 domains of work readiness. 2 of them is ethic and legal responsibilities, and the other one is the practical skills. And based on the research, that the practical skills related to the pre-hospital care was the lowest score, which is predictable because during their nursing education, they're not really, have been taught how to provide care in pre-hospital care. And ethics and legal responsibility was the highest domains. I think it also makes sense because in nursing as well, we also teach them related with the ethic and legal responsibilities as a nurse. And based on this list as well, that theoretical knowledge and lifelong learning domains were significantly different based on the time since graduation. In my study, it was limited fresh graduate up to 2 years after the graduation. So the longest they are graduate, so they're good in theoretical knowledge and lifelong learning. And what is the implication of this research of study one? So specific per-hospital content is needed in Indonesian nursing education. Either informal and formal education is essential. So this is because, like I said, nursing education in Indonesia focusing mostly in hospital care instead of pre-hospital care. So we need to enhance their knowledge and skill related to hospital care, whether informal or formal education. That's the result of the study one. Now let's move to the study two, which is the knowledge, attitude, and practice of ambulance nurses in pre-hospital care in Indonesia. The study, I was investigated the nurses who already working on ambulance. I did ask them whether they're good in pre-hospital care in terms of knowledge, attitude, and practice. So it was a quantitative study as well, using questionnaire adopted from previous study by Kumar et al., Indian Studies, 2008. Pilot study was undertaken involving 14 Indonesian ambulance nurses, and the Quran alpha was 0.9. And the study involved 14 hospital and 31 puskesmas in Malang area. 170 participants from the hospital involved in the study, which is 91.9% response rate. And then 312 participants from the puskesmas or community health center services participate in the study, and with the response rate 83.9%. Total participant was 482 participants for this study too. So most of the participants coming from the puskesmas, because the health facilities, pre-hospital care, mostly focusing on outside of hospital, which is the puskesmas or community health center services provide more the ambulance services. But we can see the result that the participant attitude score for pre-hospital care was the highest score, and knowledge of pre-hospital care was the lowest score. This one is related with the study one, that the practical skills of nursing graduates was the lowest. And for nurses who already work on ambulance, we can see that the knowledge of pre-hospital care was the lowest one, and the attitude was the highest. It also related with the study one, which is the legal and ethical issue. The ethical domain was the highest for the nursing graduates, and for nurses who already work, the attitude score was the highest. And the study also revealed that knowledge and attitude and practice score were significantly different based on the training experience. So I did investigate it, asking them what kind of training that they already got, that they already undertaken during their nursing profession, focusing on emergency-related training. And yes, it was has a good, not good, like a high significance with their knowledge, attitude, and practice based on their training experience. The more they have training in emergency, the highest knowledge and attitude and practice of the pre-hospital care. And the education level of participants contribute significantly to the difference of attitude and practice, but not on the knowledge. So in general knowledge, that the higher education that you have will be the higher knowledge that you have, but not is based on my research. That the knowledge level of pre-hospital care is not really significant based on their education level, but yes, for the attitude and the practice. And the knowledge and practice for pre-hospital care of hospital-based ambulance were significantly higher than puskesmas. So, like I mentioned before, that there are two major health facilities in Indonesia: the hospital and the puskesmas, or community health center. And based on my study, that the knowledge and practice of nurses working in hospital is higher compared to the ambulance nurses working on puskesmas. So this is because usually the hospital has better management in human resources, so the nurses will have more opportunity to have training compared to puskesmas nurses. And also the cases, because the facilities in puskesmas and the hospital, for sure the hospital has more facilities, more human resources, better compared to the puskesmas in terms of facilities and human resources. So the people, the community, tend to go to the hospital instead of going to the community health center. That's why the ambulance nurses tend to have like a more, the more people they will see, yeah. But based on the cases, the difference or the discrepancy of the level of the cases, whether it's like a just minor injury or maybe like a severe injury, will mostly will come to the hospital. That's why the knowledge and practice of the hospital-based ambulance is higher compared to the Puskesmas ambulance nurses. And the implication of this one is that so we need to enhance the knowledge and attitude of practice for the Puskesmas-based ambulance nurses, and also the national regulation covering human resources for pre-hospital care is needed, whether it's educational and clinical level. So that's the result for the study 2. And let's move to the study 3, the last study. It was qualitative study. I investigated the barriers and solution to implement the MS system in Indonesia from a decision maker perspective. In here, I interview the head of emergency department who are responsible for ambulance services using the structured interview. And the question was during the interview were based on the previous study by Levin et al. 2007. So the difference between the other two, the first two study was quanti and this one is quali. And the first two study involved mostly in Malang area, East Java province. But for the study 3, I involved 6 cities in Indonesia, including Palembang, Jakarta, Surabaya, Makassar, Denpasar, and also Malang itself. So it's not only involved in one area, but involved in 6 cities in Indonesia. Why I choose this 6 cities? Because based on the previous literature, previous study that those 6 cities implemented the previous 118 ambulance services. So it's really beneficial investigating them, what is actually the problem, why Indonesia do not have very good pre-hospital care, and what is the solution based on their opinion. And the theme divided into 2, the result, which is the problem and the solution. The problem. So based on my research that there are 1, 2, 3, 4, 5, 6 themes coming from the problems instead of in terms of what is actually the obstacles of implementing EMS system in Indonesia. The first one is lack of government support. So yes, we have national regulation, but still national regulation is like a mandatory for each city or district to implement the system. But still, it really depends on the local government. So the local government support is really beneficial regarding the implementation of the EMS system in Indonesia. Secondly is the human resources problem. So like I said before, that the nurses are working on ambulance. Unfortunately, that those nurses are lack in knowledge, attitude, and skill related to hospital care because during their nursing education, they're not really, well prepared to be an ambulance nurses. Problem at hospital level is the problem number 3. Most of the problem at hospital level is because of the facilities that they do not have good facilities providing the emergency care, as well as the block system, the block, what it's called, the block within the ED block, yeah. So actually the patient already finished within the emergency department, they should go to inward facilities, but still the inward facility is full. There is no more bed at the back, so they struggling how to manage the patient within the ED. If the emergency cases is already solved. And then the community awareness also become the problem. The previous 118 ambulance services, there were most of misuse of the 118 ambulance services. So not all of the call related with emergency one. So some of them also, just like, asking which doctor I can meet for this kind of sick, that kind of thing. So it's not really with the emergency related cases. So community awareness is really one of the issue. We need to enhance their knowledge and awareness regarding what's the importance of those call center. And insufficient ambulance vehicles also one of the issue. Like I said before, that the most of the ambulance in Puskesmas only oxygen tank and stretcher, that's it. For the hospital base, yes, they have like a better one, but most of the community health center, the Puskesmas one, is very limited. And traffic also one of the issue, especially in the big city, because my study involved mostly in the big city, so traffic one of the issue. So it's easier for them to order like delivery for McDonald's, for example, or we now have like a GoFood, which is online food services instead of asking the ambulance services. And the solution based on my study that we should start the initiate EMS system, which is now still almost like a half of the city and district in Indonesia implemented the system, which is 119 EMS system, but still in other area, which is half of Indonesia, do not have that kind of system. For the city and the district who already implement the system, still hand to enhance, because like in Malang, for example, it's not really what we call EMS system because they work by their own. For example, like in Malang, they only have like 3 ambulances, and with the less than 14 human resources, which is only 2 or 3 nurses and midwife for the coverage to cover the Malang city area, which is it's impossible for them to be able to manage every single emergency cases. So still, the population, the community still contact directly to the hospital, or maybe using their private car to go to the ambulance, to go to the hospital. And then autonomous creativity. This is because the establishment of the EMS system really depends on the local government. If the local government do not have any like a local creativity, so it will be like hard for them if they depend on the national government, because the national government mostly only provide the guidelines, the regulation, but still the someone who will do the action is at the local. So it needs like a local creativity, how to enhance the local empowerment, for example, what kind of local, the positive view of not positive, what kind of the what is called in English, yeah. So it's really depend on the local, yeah. So the local need to have like become creative. For example, like using the private ambulance, for example, using in Malang, for example, we have the volunteers, we just need to be, involved within the system. We need to enhance their capacity in providing the healthcare services within the pre-hospital care for the volunteers. And then the next one is enhance the pre-hospital care providers' capacity. Like I said, that the nurses are very limited related with the skills and knowledge and attitude in pre-hospital care. So we need to enhance the nurses working on ambulance regarding the competencies and their capacities to provide care in pre-hospital care. And the government support also become really important, especially the funding support. Really need the funding support from the local government, especially. And then the community empowering is one of the solution for the implementation of the EMS system. So we need to enhance their knowledge and awareness of the people, how it's actually in the system works, and how to provide the first aid for their family, for example, or every single person they met at the community, for example, how to do the first aid care before the ambulance nurses coming to them. And based on those 3 studies, so the next question is, what's next? Myself and my team in Brawijaya University already try to have steps how to develop, how to enhance the nursing. We are focusing on because the system, it will be hard to get the make a better system, because it's really need the good bureaucracy, good diplomacy within the government. So we try to start with the nurses. We try to develop a program and training for nurses working on ambulance to enhance their knowledge and skills in pre-hospital care. So at least 3 activities has been undertaken. The first one we call developing a paramedic nurse course for Indonesia. This project was funded by Department of Foreign Affairs and Trade of Australia in 2015. We had 19,000 Australian grants. So, and that time we tried to, try to compare the nursing education in Indonesia and the paramedic education in Australia. Especially in this one, we try to make a case study based on the Brawijaya University and Monash University. So we try to combine what kind of topic, what kind of knowledge, what kind of skills that we already give to the students at Brawijaya, and we try to compare what kind of paramedic education in Monash University. We try to find the gaps. Yeah, we try to find the gaps. We try to find the gaps, and based on that grant, we moved to the second one, which is the piloting ambulance nurse course in Indonesia. Still funded by the Department of Foreign Affairs, the DFAT of Australia, 2016. We got the 15,000 Australian dollars. In the second project, we did the pilot project. So we asking the nurses working on ambulance, both in hospital and puskesmas. We invite them to come to the university. We teach them about the prehospital care. We also involve the expert from Monash University, from the paramedic education at Monash University. We invite them to come to Malang, and two of them teach the nurses working on ambulance. Prior of that one, we did the training of the trainer for the nursing lecturers at Brawijaya. So based on that one, we piloting this course to the ambulance nurses in Malang area. And now for the third steps, we now get another grant, but not from Australia. This is coming from the Pan-Asian Research Outcome Studies from the Asian Association of for Emergency Medical Services, the PAROS INWS. We got start from the 2018, so we got last year. We call Initiation of Paramedicine Program in Indonesia. We got the grant for 30,000 US dollars, and this project will be for 2 years project. So start from 2018 will be end up for next year, 2020. So in this project, the last project, I mean the current project, we are working with the Singapore, which is the they call it UPEC, which is Unit for Prehospital Emergency Care of Singapore General Hospital, under the Ministry of Health of Singapore. So we work with them to have like a training of the trainer, and then they will come to Indonesia to see the program as well about the paramedicine program, the nursing program in Indonesia, and then we will try to launch the program, and we'll invite all the stakeholders before we launch. Yeah, we'll invite all the stakeholders in Indonesia, including the Association of Nursing Association of Indonesia, the Association of Nurses, Emergency Nurses in Indonesia, as well as the Ministry of Health of Indonesia. We'll invite them to discuss because the first, second grants, we did not involve them, only just like informal one. But in this now, the current project, we will involve them actively. So because this one is like a 2 years project, so we will hopefully by the end of this one, we will have like a fixed schedule, fixed program, fixed the curriculum. How if we want to run, how if we want to have like a training for nurses working on ambulance. So this is some of the pictures from the previous grants, which is the DFAT grants 2015 and 2016. The developing paramedic nurse course and the piloting the ambulance nurse course in Indonesia. So two Australian staff, the expert from Monash University, come to Malang, and they train us how to deliver the training. And this is the current one. So the PAROS grant start from last year, and it was involved the not UPEC, like I mentioned before, the Unit of Prehospital Care, Emergency Care of Singapore General Hospital under the Ministry of Health of Singapore. We also involved the Nanyang Polytechnic, the biggest health education institution in Singapore, to help us to develop this program. So that's it. Thank you very much for listening. So give it to you, Professor Bupati.
Thank you very much, Dr. Suryanto. It was a wonderful presentation. Okay.
Thank you.
We will go ahead and take some time for questions now.
Just sure.
Please be sure to type your questions into the question box in your control panel. Someone is looking at our webinar at the moment. Oh, by the way, it looks like we have 2 questions by my Facebook inbox. Okay.
So
One
I'm
from
still. Oh, wait a minute.
One from Mariam from the Philippines. Her
How
question
can?
is.
Excuse me, Jerome. How can I see the full video? I mean,
Okay.
let me. La, 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 la.
All right, you see that?
No. So what about if just exit the PowerPoint? Is that okay?
Yes, yes.
Okay.
You can exit the PowerPoint. Okay. Now this is a question from Mariam.
Yes.
Her question is: have you presented your research to the Indonesian Ministry of Health?
Not yet, but I have published one paper. I published last year related with the knowledge, attitude, and practice of ambulance nurses. It was published internationally within the AANG, the Australian Emergency Care journal. So
Okay.
it was published last year. But in person, in front of the Ministry of Health, no. But just like informal session, yes, but not in formal session. But with the current project that we are now having, the Paros Grant, we will invite the Ministry of Health of Indonesia, as well as the Nursing Association, as well as the Emergency Nursing Association, will be actively involved with the current project. Hopefully, they will, have like influence what is actually in the current status of the prehospital care in Indonesia.
Oh, right. That's good. Thank you very much for that, Dr. Suryanto. There's another one from the Philippines, James from Cebu. But actually, you already presented this, but I'd just like to mention this for acknowledging James' question. His question is your university contemplating offering an ambulance service courses? So I think you have mentioned already this.
Yeah.
The ambulance service course to be offered by your university.
Yeah. So currently, the project, the three project involve not only the hospital, not only the university, but also involve the hospital. So because there is we have like a mutual collaboration with the biggest hospital in Malang and the university. So we work together, and then we always work together, and then the plan is we will create the training, whether it will be like additional training for nurses who already graduate for bachelor degree, or we can have like a from diploma as well. Still, we still have not have like a fixed idea yet for now. But yes, Brawijaya will be involved mainly provide the training, but will also involve because it's like a for this something which is it is one like a skill-based training. So we'll involve the staff from the hospital as well. So training within the academic and class, then we go to the hospital, we go to the ambulance. So we'll involve also the hospital and the puskesmas for the training, but mainly will be undertaken by university.
All right. Thank you. I'll reserve my questions later, but in the meantime, I'll ask Dr. Sanglar if you have anything to ask to Dr. Suryanto, or would like to offer some insight as well.
Yes, I have some question that do you have any other disciplines who work with you, like medicine or physician or NGO, like a volunteer people, volunteer group to help you, or the government and police, something like that? Because if we conduct only, we develop nursing system of emergency, but we should have other discipline to work with. That is okay. It's a big project, but it still we go together like this. Do you have some? Yes.
Yep, definitely, Dr. Palmak. So for the current project, we have 4 board members, which is one is I'm the lead investigators coming from the university as a nurse, and then one as from the nurses from the hospital, which is nurses clinician, because educators, just educators. We need something from clinical and practice.
Yes.
And then the other 2 is a medical doctor, which is emergency medicine specialist. So because for sure in Indonesia, creating something new is not as easy. Yeah, I think it's like common knowledge. And then by involving those two emergency medicine specialists, it will like have like backup, or maybe like more power for us if we want to create the training, not just from the nursing perspective, but also from the emergency medicine specialist. The emergency medicine specialist, the good thing is the emergency medicine specialist program is available only in Malang in Indonesia. So they also want to us, I mean, like nurses have like working together with them. So if they already like increase the level of become like emergency medicine specialist, so nurses also want they also want nurses also going higher and higher, so we can work together. So that's why we also involve the emergency medicine specialist program. But in the real practice, we will involve the volunteers as a participant for sure. But for the establishment of the program, we nurses from the academia and the clinical, as well as the emergency medicine specialists. Yep.
All right. Thank you very much for that, Dr. Sanglar.
Can I share my experience in
Yeah,
Thailand?
sure, absolutely.
Yeah,
Yeah.
because in Thailand we have struggling of this situation as you like in 10 years ago, Thailand we have a problem with how to refer people who injure or have severe sickness from their scene to the hospital. They have a lot of problems, but luckily we have some volunteer group. They already conduct themselves to they want to help people in their what is that, their point or their place. So we have a lot of volunteer who are what is that, I can say they stay around in Thailand, many groups. And then we have a problem that even they reach access to the injured patient very quick, but they have a lot of not well trained, and then they make them more injured or sometimes die because they did something not good, but they want to do it. So that's why we developed that system to what is it, train them first aid or CPR courses for them. But I don't know in your country, but we have a lot. So we control them by give them the knowledge. Unless they will do something is not good enough. So now we have a lot of people who was trained from my university also. We provide them the knowledge. But also the nurse, we still have a problem with the shortage of nurse who well trained also. Yes, because some nurse who already well trained and then they transfer to another hospital who very what is that comfortable to work and high salary, something like that. So we have a problem also. But the system is better and better because we looked 10 years ago. And that, as I said, that you have to ask for the cooperate from other disciplines. That's you said that community wellness is one of your barrier. Yes, because if the community awareness is not good enough, then everyone will said it's not my duty, so you can go. So the traffic still stuck. Even you very good in carrying in your emergency car, but or ambulance, you cannot go by the traffic stuck on. So that's why we announce everything that how can you what is that avoid to stuck on the road. Even whenever you heard the siren, everyone try to move on the way, so we can go by that what is that, we can go by even we have traffic, but we still have the problem because we have a lot of traffic jam as well. But actually we try to warn them that if you someone in your family have injury or sickness, if someone stuck on the road and you don't care about that, so you will have something hidden with you also. So that's why we try to do the community awareness of that. Everyone will try to do that, and that's why I'm asked. You said that one more thing, the communication. You have a lot of communication, like the call center, right?
Yes.
Yes. We have a problem in the past, but now we are better, I think, because
Good,
now if
good.
you call 1669, and then the call center will attribute to all of the area, and then everyone will know who are nearest. So they will come and take care of like a volunteer. They're very quick to access. So if they were well trained for just first aid, they know how to fix the leg when they are
Mm.
broken. Yeah, very well now. And then if they access faster than the hospital because they are nearest in the village or in the point, so they access very quick. And then they will fix and wait for the EMS come. That is very good point. I think maybe we pursue people to take care of
Yeah.
that.
All right. Thank you very much
Thank
for that,
you.
Thank you very much. Thank you.
Dr. Zangler. Yeah, we are already joined by two colleagues here from, I think, Indonesia. We got
Indonesia, yeah, yeah,
Haryono and Sigit Haryanto.
yeah.
Okay.
Yep.
Can we have an
Thank you very
insight
much.
from Lauren? Lauren,
Yes, sir.
share something?
Okay. Sir Suryanto, can you hear me?
Yes,
Hello.
yes.
Okay, Sir Suryanto. I'm very interested with your research, sir, because what happening in Malang City, the same like our province. Malang
Yep.
City is the city, right? The
Yes.
same like our province, because our province is the same like remote area. We call it like that
Yeah.
because our province is still developing city. Sir Suryanto, what happened in Malang, the same like our province, too. How to improve the knowledge of the society in here is still difficult to apply by the government here and by the educator in our
Yep.
Okay.
So yeah, can I make a comment, Jerome?
Yeah, sure. George.
Yeah,
Lauren,
yeah.
go ahead.
So thank you very much.
Thanks, Lauren.
Yep, Dr. Ponok. Based on the your experience, we can have like a lot of lesson learned. That actually in Malang also I mentioned before that there are more volunteers, not more, but it's like several volunteers in pre-hospital care. So, but like as I said before, I think similar with you in the beginning that the 10 years ago that most of them are not well trained. Yeah. So that's become one of the program, one of the plan that we are going to undertake. That we will try to enhance their knowledge and skills, because the nurses maybe we are not shortage of nurses, but we have plenty of nursing graduates. I mean, but the work the job opportunity is not as the job opportunity is not as many as the nursing graduates. So not many nurses sometimes
I know
working.
that you have many level of nurse like
Yes, yes, it is.
yes,
Yeah.
yes.
So thank you very much. So we also focusing on the volunteer as well. Yeah, thank you very much. So for the Mr. Lawrence, that the community.
yes, sir. Hello,
Yeah.
sir.
Yes, the community
Can you
awareness also become one of the
me,
issues.
sir?
And even though it's difficult, we have to start. Yeah, from something small. For example, in Malang, for example, I'm a lecturer, and one of the program is the community services. We try to have like a program how to give training for especially for the CPR for layperson. So we did many times for the training for the layperson how to do the CPR. So that's one of the steps, to improve the system, to create the awareness of the people in Malang area. I think the problem is the people in Malang, not in Malang, in Indonesia, very huge population. Yeah, so it's not an easy task to improve their knowledge and skill in hospital care. So some of the people, for example, like compared to like small city, for example, like a small country like Singapore, for example, it's easy for them to manage. Small people, well educated, easy. But in Indonesia's very huge country, we have like almost like 17,000 islands with 250 million people. It's not easy. So like I said before, like in the local creativity, for example, like we will start from Malang. So we'll try to have like a pilot project in Malang. We try to train the nurses working in ambulance. We try to train the volunteers who can help in hospital care. So we'll start from Malang area. Hopefully, it can be like become the like a national it become like a pilot project for the national level. So that's.
But I think the most but the strongest of your country is you have a very good Wi-Fi, right?
Very good what?
Very good internet.
Oh, internet.
Yeah, internet signal is very strong, and I saw everyone use it.
Mobile phone, yes.
Yes. Yeah, I think the most important that if you can make the spot announce like I don't know, pursue the governments how to make the announcement, how to do the CPR procedure. Yes, spot every hour. I don't know how to. Yes, yeah. Because everyone has internet, so they can watch it, repeatedly watch it. From my experience, even the layperson or the volunteer, they already trained, but they still forget. So every time they have to practice it with the mannequin and the CPR every time that we have time, we repeat them every time because they forget. Because
Thank you very much for that, Sanglar and Lauren. From my insights, I think, and based on my experience here, Australia is one of the leading countries in terms of EMS.
Absolutely.
I'm glad that Dr. Suryanto was able to connect with the experts here in Monash University, and he was able to get that support from them. And even after post-PhD activities, they were there to help him. And they're so generous. And I think you can learn from this experience, and you can help many countries in Southeast Asia, particularly in the Philippines, which is also has the same situation in terms of the EMS thing. I would say that you will play a prominent role in the next 10 years and try to build up these competencies in Indonesia and probably in Southeast Asia. And that's for one. The second thing I would like to note down here is that Indonesia is really a thriving country right now in terms of in the digital economy. And you're one of the examples here in the transport innovation. You got Gojek, and I don't see any problem when Dr. Suryanto will be able to scale up this study into something like an innovation in EMS in Indonesia, and who knows, in other countries. Hands off to you, Dr. Suryanto, for doing this kind of studies. Okay, it's not just an ordinary thing, but we hope to see that in a few years' time, this will become a big one.
So,
any more questions? Thanks. Anyway, you get something to say.
With the online system like Gojek, for example, the online transportation. One of the innovation and the creativity is in West Java province, that they also provide the ambulance services using online mobile application.
All right.
Just like online application, but for ambulance. So one of the creativity. And also, I would like to, Dr. Sanglar mentioned about the internet access, So one of the creativity as well, using the mobile application for the ambulance services as well, and also for the training. So some of my students, some of them also creating the application to have like a, CPR training using the application. So it's good as well. Yeah, it's very good.
Thank you very much. Nice to hear from that. Okay. It looks like we've covered all of these major issues. we have a debriefing later after this.
Yeah, sure.
Is there anything else you wanted to cover up before we wrap up? Lauren, would you like to say something? Or Sanglar? If not, then okay.
I hope that I heard from you, Dr. Suryanto, that you will have a big project from have a budget for do that. But I hope that in the future you can develop it more better and better. And need time. I know that it's a big project.
Yeah, I know that. Yes,
yeah.
I know that. Yeah.
If you have any what is that? You can train. You can send some nurse or your instructor to be trained in Thailand.
Oh, good.
That's good. Thank you very much for that.
Good.
All right. Okay. It was a pleasure being with you today, guys. We appreciate you being here. I would like to thank Beta New Delta Nursing Society for being part of this activity, and it will host the video in our YouTube channel, Nursing for Humanity. Dr. Suryanto himself, okay, for a generous presentation. Lauren and Dr. Sanglar. Okay, thanks again for joining us today, and we will see you next time.
Thank you.
สวัสดีค่ะ